Right, it's time for another check-in with the twin doctors for a discussion about health and fads, health fads.
Yeah, so this morning we have a few questions for Doctors Idries and Jamil Abdur-Rahman, also known as Dr. I and Dr. J. It's always so good to have both of you in studio. So we usually do our true or false, but we're actually, Adrienne and I have a couple just health questions we wanted to pick your brain on first. Can we start with tinnitus?
Yes.
It's that ringing in the ear.
Yes. Thank God I never had that.
I haven't either.
That's hard.
You guys jinxed yourselves. So tinnitus is super common.
Where's the wood?
Knock on the wood. Most of us have experienced it. I've experienced it sometimes as well, but like 20% of Americans have it, and 20% of those have really severe cases. So you can hear ringing, buzzing, whooshing, and it can be caused by a multitude of things, you know? But it's super common. And the problem is there aren't a lot of things that really help with it, you know? For some people, this can be really debilitating. There's actually a new study that came out that showed that a combination of electrical stimulation, very low-grade electrical stimulation, you don't even feel it, and auditory stimulation for 30 minutes a day over a span of about 6 weeks does wonders. So yes, tinnitus is super common. You probably had it, you maybe didn't even notice it. You'll hear it sometime when you're trying to sleep. Super common, but there are some things coming out that will actually help. So help is on the horizon.
I think some people felt that with COVID too. Wasn't tinnitus one of the things that people were experiencing?
Absolutely.
There are a lot of
first symptoms I got, believe it or not.
Really?
I got tinnitus, and I started to get car sick when I drove, which was weird for me.
Oh.
And next thing you know,
You knew something was up. Yeah.
I had car sickness as a kid, but that's because I was in the backward seat in the station wagon. It had nothing to do with being sick. Yes, yes. Well, the FDA also approved the first pill specifically used to treat postpartum depression. Was this important? I mean, the fact is there were already antidepressants on the market that a lot of women used. Why was a specific pill for postpartum needed?
well, because of the way that this pill works, I think that's the big thing. So first of all, with postpartum depression, people don't realize it's super common. 1 in 7 women suffer from it. And what people also don't realize is it has a lot of morbidity associated with it, both for mom and baby. Second leading cause of death in women after pregnancy during the postpartum period is suicide. Yeah. And in most of those women, it's from postpartum depression. And before, like you said, we used antidepressants, which kind of got at the issue, but didn't get directly at the issue. This gets directly at the issue. When you're pregnant, you have high levels of this hormone called progesterone. And when you deliver, those levels just plummet. They don't go down slowly, they plummet. And basically, some women are very sensitive to that with those progesterone receptors in the brain, and so they get the postpartum depression. This basically helps to mimic the effects of progesterone in the brain, and so it's getting directly at the issue.
I have a question, though, to follow up, because progesterone, I found out for myself, as a woman who hasn't had a child yet, is extremely important for women premenopausal.
Absolutely.
Why can't pregnant women who are experiencing that postpartum depression just take an extra dose of progesterone?
I mean, in theory, you could, but that can sometimes increase your risk of clotting. So estrogen in particular can increase your risk of clotting, but progesterone can as well.
And have you heard of placental encapsulation?
Yeah,
sure have it.
Yeah.
So when people actually eat their placenta, either eat the placenta or they freeze dry it. And some women do that because they say it puts that hormones back into their system and it helps with depression. That's something I recommend.
I was gonna say,
not something you recommend.
I don't recommend it.
We do not endorse it.
I don't endorse it, but some people say it helps, and that's the same premise, putting those hormones back in. So
There are different variations of treatments, is all I would
Yeah. We would say go with the FDA approved Zurzuvae, please.
Okay. Women have options.
They have options.
Okay, let's get into our usual true or false game. We're going to start here. True or false, robots will soon replace doctors for breast cancer screenings.
We're done. I'm going to take off my shirt. We're done.
So that is false, but with the caveat, So when you get your mammogram.
You thought it was true?
Yeah, well, it seemed like one of those. Sometimes y'all throw them in there, and I'm like, that's too random.
So when you get your mammogram, your radiologist looks at those films, right? And they look at them, they compare them from year to year to year to see if there are changes. So they actually did a study where a radiologist looked at the films and an AI looked at the films, and they found that the combination was actually better than just a radiologist. So we're not going anywhere.
Good.
The AI is going to help us.
Not getting us out of here.
This second question is a trick question. I know it is. True or false? Feeling good after 50 is a myth for women. As women age, they are more prone to depression and mood disturbances. Is that true or false? I'm going to say
Feeling good after 50
true.
is
I want to say false so bad.
I'm saying false.
False. It's false.
Thank God.
Yeah. So actually,
There's hope.
Yes, there is hope. So you actually see less depression and fewer mood disturbances after menopause. And again, it kind of comes down to those hormones we were talking about earlier with postpartum depression. So monthly, women's hormones tend to fluctuate. Estrogen and progesterone.
We don't know anything about that.
Oh, yeah. I'm here to tell you all about it,
Right from age 14 to now.
And these fluctuating hormone levels basically cause these mood disturbances. After menopause, those estrogen and progesterone levels just level out, and you tend to see fewer of the mood disturbances. So most depression and mood disturbances seen in women between 14 and 44. After that, you tend to see happy, mature,
Well adjusted.
But that's why you got to take those hormones, because you can be happy if you take progesterone. I'm telling you, it will change your life. Get your
100%.
hormones tested, 20-somethings and 30-somethings.
100%.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.